Imagine being told that strangers across the country are praying for you every single day while you lie in a hospital bed waiting for heart surgery. It sounds like comfort. It sounds like hope. It sounds like the kind of thing that should only help. But in one of the largest medical studies ever conducted on prayer, something strange happened. The patients who knew they were being prayed for did not get better. Many of them got worse. Today, we are going to walk through exactly what happened when researchers tried to measure the power of prayer on 1,800 patients and why the results left scientists, doctors, and religious leaders completely stunned. Stay with me until the end because the reason behind this backfire will change the way you think about stress, hope, and the human mind. In the early 2000s, a team of researchers wanted to answer a question that had been debated for centuries. Does prayer from other people actually help a sick person heal faster? This was not a small backyard study. This was a massive coordinated effort involving several major hospitals across the United States, including some of the most respected cardiac centers in the country. The study became known as the STEP Project, and it focused on patients who were about to undergo coronary bypass surgery. Bypass surgery is already one of the most physically demanding procedures a person can go through. The chest is opened, the heart is temporarily stopped, and blood vessels are rerouted to keep a person alive. Recovery is long, recovery is painful, and complications are common even under the best circumstances. The researchers divided the patients into 3 groups. One group received prayer from strangers but did not know whether they were being prayed for or not. A second group did not receive prayer and also did not know either way, and a third group received prayer and were told directly that people were praying for them. This third group is where things took an unexpected turn. The idea behind the study was simple. If prayer works as many believe, then patients who received it should recover with fewer complications compared to those who did not. The researchers who organized the intercessory prayer had volunteers from several religious groups pray for these patients by name every single day for weeks. This was not a casual gesture. It was structured, consistent, and taken seriously by everyone involved. When the results came in, doctors expected one of 2 outcomes. Either prayer would show a clear medical benefit, or it would show no effect at all, making the study essentially neutral. What nobody expected was a third outcome. Patients who knew for certain that they were being prayed for actually experienced a higher rate of complications after surgery compared to the other groups. Things like irregular heart rhythms and other post-surgical issues appeared more frequently in this specific group. Let that sink in for a moment. The group that was given the most reassurance, the most spiritual support, and the most reason to feel hopeful ended up with worse physical outcomes than patients who had no idea whether anyone was praying for them at all. So why would this happen? How could something meant to comfort a person actually work against their recovery? Researchers began digging into the psychology behind the results, and what they found was fascinating. One leading theory is something researchers call performance pressure. When a patient is told that many people are specifically praying for their successful recovery, it can unintentionally place a heavy emotional weight on their shoulders. Instead of feeling calm and supported, some patients may have felt an unspoken responsibility to get better, almost as if failing to recover would let down all the people who prayed for them. This creates a strange paradox where an act of kindness turns into a silent source of anxiety. Think about it from the patient's point of view. You are lying in a hospital bed already scared about a major surgery. Now you are told that dozens or even hundreds of strangers across churches and prayer groups are specifically asking for your successful outcome. For some people this brings peace. But for others, especially those who already carry anxiety, it can trigger a subconscious fear of failure. The body does not separate emotional stress from physical stress very well. Elevated cortisol levels, increased heart rate, and heightened nervous system activity can all interfere with healing, especially after a procedure as delicate as heart surgery. Another theory researchers explored involves the power of expectation itself. Humans are deeply influenced by what they are told to expect. If a patient believes they should feel a certain way because of the prayers being said for them, they may become hyper-aware of every twinge, every irregular heartbeat, and every uncomfortable sensation during recovery. This heightened awareness can sometimes worsen the perception of symptoms, even if the physical reality is not much different from other patients. In medicine, this is closely related to what is known as the nocebo effect, which is essentially the evil twin of the placebo effect. Instead of expecting healing and experiencing improvement, the mind can sometimes expect pressure and experience decline. Now here is something important before we continue. This video is not attacking faith, prayer, or spirituality in any way. Millions of people find genuine comfort, peace, and strength through prayer, especially during difficult health struggles. What this study reveals is not that prayer itself is harmful. It reveals something deeper about how the human mind processes pressure, expectation, and awareness during vulnerable moments. It shows just how powerful psychology is when it comes to physical healing. The mind and body are connected in ways modern medicine is still trying to fully understand, and this study became one of the most talked about examples of that connection going in an unexpected direction. If you are finding this breakdown eye-opening, make sure you hit that subscribe button right now, because Dr. Watsun brings you deep dives like this every single week, uncovering the hidden science behind health stories that mainstream media rarely explains this clearly. We break down real studies, real data, and real medical history in a way that actually makes sense, so you are not left guessing what it means for your own health or the health of someone you love. Subscribing means you will never miss the next story that could genuinely change how you think about your body, your mind, and your well-being. After the STEP study was published, it sparked massive debate across the medical and religious communities. Some religious leaders pushed back, arguing that prayer cannot be measured or tested in a controlled laboratory environment because faith operates on a spiritual level that science was never designed to capture. They argued that reducing prayer to a checkbox in a research study misses the entire point of what prayer represents to believers. On the other side, many scientists pointed to the results as powerful evidence of the mind-body connection, suggesting that whether or not a higher power was involved, the psychological impact of knowing you are being watched or prayed for is real and measurable. What makes this study even more fascinating is that it was not the first of its kind, but it was by far the largest and most rigorously designed. Earlier, smaller studies had produced mixed results, with some showing slight benefits from prayer and others showing no effect whatsoever. Because of its scale and structure, the STEP study became one of the most cited pieces of research whenever this topic comes up in medical journals, documentaries, and academic discussions. It forced researchers to reconsider how they study faith-based interventions, and it highlighted just how difficult it is to separate belief from biology when studying human health outcomes. For elderly patients specifically, and for anyone managing a serious health condition, this study carries an important lesson. The emotional environment surrounding a diagnosis or a procedure matters just as much as the medical treatment itself. Stress, anxiety, and pressure, whether they come from family expectations, financial worries, or even well-meaning support, can influence physical recovery in measurable ways. This is why doctors increasingly emphasize mental and emotional preparation before major surgeries, not just physical preparation. Things like guided breathing, calm, reassuring communication from medical staff, and reducing unnecessary pressure before a procedure are now recognized as valuable tools that can genuinely support better outcomes. So what can we take away from all of this? First, faith and spirituality remain deeply personal and valuable to millions of people, regardless of what any single study shows. Second, the human mind has an extraordinary influence over the body, especially during moments of vulnerability like surgery and illness. Third, when we support someone who is sick, the way we offer that support matters. Simply telling someone, "Everyone is counting on you to get better," even with the best intentions, can sometimes add pressure rather than peace. Instead, offering calm, steady presence without emphasizing outcome expectations may actually be more helpful for someone's mental state during recovery. This story is a powerful reminder that health is never just physical. It is emotional, psychological, and yes, for many people, spiritual as well. All of these layers interact with each other in ways science is only beginning to fully map out. The STEP study did not prove that prayer is harmful, nor did it disprove the power of faith. What it did prove is that the human mind is far more influential over healing than most people realize, and that even the most well-intentioned gestures of support can have unexpected effects on a person already carrying the heavy weight of illness or surgery. Before we wrap up today, please remember that this video is for educational and informational purposes only. It is not intended to replace professional medical or psychological advice. If you or someone you love is preparing for surgery, managing a chronic illness, or dealing with anxiety around a health condition, please consult a licensed doctor or mental health professional who can guide you based on your specific situation. Every person and every body responds differently, and only a qualified professional can give guidance tailored to your needs. If this video helped you understand something new about the connection between mind, body, and healing, do not scroll away just yet. Hit that subscribe button, turn on notifications, and drop a comment letting us know what surprised you most about this study. Dr. Watsun is here to bring you the science behind the stories that actually matter to your health and your family's well-being, and we have many more eye-opening breakdowns coming very soon. Thank you for watching, and we will see you in the next one.